are glucagon-like peptides, and the way that they act is that they decrease reward in the brain. So you have decreased reward for eating. But now we're starting to get testimonies from patients that they also have decreased reward from other behaviors that we consider addictive behaviors, like alcohol. They have a decreased desire for alcohol.
Do we have enough data to know that these drugs could be safe for the average person to take for 5, 10, 20 years?
And so when we look at this aggregate data, this long-term data, you are right. We will have to follow people over periods of time. But the data that we have was sufficient for FDA approval for specific indications for diabetes, and then one of the compounds for obesity as well. And so in those trials, the FDA was satisfied that not only did these drugs meet their endpoint, in other words, do what they say they're going to do, but they were also safe. And safety is also the first thing that we look at. To your point with regard to following them out 10 or 20 years, you are absolutely correct. We do not have that data.
And Dr. Morgan notes that the data also shows these sorts of drugs are only effective if you continue to take them. She says it's looking like they may be maintenance drugs. So think about, cholesterol and blood pressure medications you take every day or all the time. Of course, for now, these GLP class of drugs can be very expensive. So cost control discussion